So, welcome and thank you for joining us and taking the time to engage in our discussion tonight on navigating social injustices amidst a pandemic. This is part of a series of collaborations between the Toledo Public Schools and the College of Medicine and Life Sciences, as we hope to listen first and then meet the needs of the community we serve. Someone asked me recently why the College of Medicine and Life Sciences was collaborating with TPS. Where was the connection? And my response is, where is the disconnection? Because when it comes to our mission to care for our young people and the families in our community and promote an education for our students, physicians, and providers, there is no disconnection between our mission to serve and the needs of the people we are privileged to care for. As we're dealing with the trauma of racial injustice, we must recognize that when the young people in our community are hurting, we in the College of Medicine are hurting too. When we see there is despair and the feeling that Black lives don't matter, we in the College of Medicine must take steps to validate that they do. So we are proud of our ongoing TPS high school pipeline programs and collaborations, our summer REACH program, our year-long STARS programs where we mentor students who are interested in careers in medicine. And even in the midst of all of this and all of the things that are going on, we must continue to offer hope and encouragement and give tools for success so our students can still achieve their goals. So we're happy to engage in our dialogue tonight. Everyone on our panel will provide some expertise, experience, and insight into how we can better take care of ourselves and care for our communities, listen to each other, and learn from each other. This is an opportunity for us to lead with compassion as we strive to more fully become who we say we are. So thank you again. Our program overview includes program objectives, panel statements and introductions, a Q&A, and then some closing remarks. I'm also going to read the community care statement. As a participant in this roundtable, we ask you to be respectful of your peers' thoughts and opinions. The intent of this roundtable is not to be confrontational or argumentative with one another, but to be a space where UToledo and the public schools community members can be their authentic selves and share their thoughts and feelings within a civil manner. Thank you.
We're here to provide a safe space for the community regarding the tragic and unjust killings of Black people. In addition, we'd like to create an environment of solidarity and support. As Dr. Jenkins stated, yes, we are collaborating, and this is an ongoing collaboration with the medical college. So we want to continue to show our solidarity by continuing our collaboration with them in this space. We also want to highlight campus, district, and community resources that will aid in coping with trauma of our current unrest. If we have time at the end of this program, we will entertain any questions that we may have in the chat or in the Q&A. So please feel free to put any questions that you may have there. And again, if we have time at the end of the event, then we will address those questions. So at this time, I'd like to turn over the program to Dr. Hope Bland, who is also with Toledo Public Schools. The program starts.
Good evening. What I'd like to do this evening is to begin by introducing our panelists for this roundtable discussion. We're going to begin with Ms. Ashley Futrell, Esquire, who is an attorney and community advocate, Mr. Brother Washington Muhammad, co-founder, Community Solidarity Response Network, CSRN, and Dr. Darren Gordon, University of Toledo MD, Ph.D. candidate, and former National Speaker of the House, Student National Medical Association. I'd like to start with asking our panelists just to say a brief statement about themselves, and we can start with Ms. Ashley Futrell, please.
Thank you so much, Dr. Bland. Hi, everyone. My name is Ashley Futrell. I am a native Toledoan, and about 2 years ago, I came back to the Toledo area to serve as an assistant United States attorney in the U.S. Attorney's Office here in Toledo. And prior to that, I served as an assistant district attorney, or essentially a state prosecutor, in the Manhattan DA's office in New York City. And before I even went to New York, I went to law school at Howard University School of Law and spent about 13 years in DC working in public policy and advocacy. So many of the comments and the thoughts and ideas that I have today will be guided by the work that I did on the advocacy side before I went to law school. And the last thing I'll say, I'm extremely involved in my community because there's a quote that really inspires me, and it's by Dr. Martin Luther King Jr. He says, "Everyone can be great because everyone can serve." And I think that especially in this time with what's going on in our country and in our community, I believe that that is exactly true, and everyone can serve in their individual space. So I just want to thank the Toledo Public Schools, the University of Toledo, and for everyone else for joining us today. Thank you.
Thank you, Ms. Futrell, for that important introduction. I'd like to also ask that Brother Washington Muhammad share a few statements as well.
Yeah, thank you, Dr. Bland. I'm Brother Washington Muhammad. I use the prefix brother because I'm an active and registered member of the Nation of Islam here in Toledo, and I became involved with the Nation of Islam in 1991. So I've been a part of the activist community for 29 years now. In 2014, we formed CSRN, the Community Solidarity Response Network. We wanted to take a different approach to social justice outside of politics and religion. And as of right now, it's been 6 years since we've been organizing and planning that way. And I can't wait to see what's next. And also thanks for TPS and the University of Toledo for having this discussion.
Thank you. Thank you, Brother Washington. Next, we will have Dr. Darren Gordon. Could you please share a brief statement as well?
Hello, everyone. So my name is Darren Gordon, a student at UT. So a lot of my advocacy work has been surrounded by my interest in wanting to increase the number of underrepresented minorities, specifically Black children, in medicine. So I've worked with the SNMA for almost 10 years. So pretty much since my second year in college, I've been working with the SNMA. And we do a lot of things from a local standpoint to a national front. So I'm appreciative to have this moment to give a little bit of my insight, speak a little bit to what I think what I think we should be doing and how that's been informed by my experience working with the SNMA.
Thank you very much, Mr. Gordon. Okay, we are going to move now into our question segment. And these questions will be directed to our panelists. I'd like to start with, according to a recent Pew Research Center survey of about 9,600 US adults, sometime in June last month, this survey consisted of predominantly young adults as well. This survey looked at individuals who participated in the recent unrest of protests that just took place across the country. And I want to take just to kind of talk, briefly share out some of the statistics in terms of the number of the groups in terms of race and age. There were 46% white individuals who participated in some form of protest. There were 17% Black, 22% Hispanic, and 8% Asian. There were the average age of individuals who participated were between 18 to 29, where it was about 41%, and 38% between the ages of 30 to 49. The first question that I have for our panelists is, given the momentum to address issues of racial discrimination in the United States as a result of the murder of George Floyd, Mr. Floyd. How do you think the momentum needs to remain strong, if at all? Also, what next steps do you feel are necessary?
I'll start. Thank you for that question. I think it's very timely and appropriate right now. And the first thing I'll say is that the first step that I believe that we have to do is figure out what role each of us plays in this conversation. And what I mean by that is anyone who's working, every role isn't for everybody. But when it comes to talking about things like building a momentum and a consensus, I think it's important to figure out what is our role. Are you an agitator? Are you an innovator? Are you an orchestrator? And what I mean by that is, exactly what is it that you think that you can do best? Also, I think it's important to figure out what is the lane that you're in. Are you an attorney? Are you a doctor? Are you someone who is very involved in the community involved in different organizations and boards? Are you someone who wants to get more involved? Are you an artist? I think that once we figure out exactly what lane we're in, we can then go into the next question, which is, what do I want to see changed? And I think that once we figure that out, and I would encourage everyone to look in their community and drink and think, what could happen to improve my community? What could be done? Once we identify that, and especially once we realize what lane we're in, we can move forward. Now, as I mentioned before, my background is in advocacy. So I'm very passionate about doing the background research and figuring out that thing that you want changed, how can it happen? Is there a thought leader that you can talk to who can get that done? Now, that could be your member of Congress, it could be your mayor, it could be someone that's involved in local politics. And once you identify what you want to get done and who can help you get that done, at that point, you do your research so that you can meet with those thought leaders and make an ask. But you're coming to the table with your research that you've done and your experience from the particular industry that you're in. Once you make that ask, I would strongly suggest following up and working with other like-minded individuals as well as organizations to really build a coalition so that it's not just your voice that's out there, but it's like-minded individuals as well. So just to answer your question, I believe the first step is doing a little bit of an internal search, figuring out who you are, and then figuring out who you need to talk to and partner with in order to make sure that the change that you want is accomplished. Thank you.
Thank you for that, Ashley. Absolutely. And we also understand too that we have to look at the needs of our community, as you had suggested as well, and understanding what those needs are before we can determine what direction to take.
Absolutely.
Thank you.
I like to add on to that. I think that the momentum needs to stay and remain strong. I've been a part of the protest activity from 2014 when a lot of us were saying hands up, don't shoot, regarding to Trayvon Martin and Michael Brown. And when it switched over to Black Lives Matter, I think that there's a lot of people that understand what needs to happen. And the protest is also a place where everyone can meet. Usually from the outside, it may look like an angry mob, but there's people like myself inside the mob talking with those that may be involved in education, may be involved in urban gardening, may be involved in politics. And we talk about policy right there on the corner during the march. So the protest in here in Toledo, I'll call it a protest awareness activity, because we're not trying to fight to get into something. We're trying to let people know that something is wrong, and there's no better way of letting people know that there's something wrong by other than like having everyone on street corners with signs. So there's a lot of people that understand what needs to happen. And right now, some of the policies regarding body cams, civilian review board, defunding, um, these are policies that a lot of us have been talking about for years. Now, because of the activism, a lot of us are starting to unite and push for these types of things. And I like what the person said before me regarding knowing your lane. I spoke with some of the local pastors about how can they get involved, because activism today doesn't require someone to be a pastor or a politician. The young people already got it. So a lot of us are late to the party, but we can find a space. We can find a space to help, support, not necessarily lead or take over, but I enjoy what's happening right now, and I do believe that the activism needs to remain strong because there's energy in that. And so I don't want to keep talking, but um, that's all I want to say on that right now.
Thank you so much for that, Brother Watson. And I can wholeheartedly agree with you. Again, as I mentioned the data, there were about 9,600 adults that were surveyed, and the overwhelming number of young adults participated in this protest. And I think they get it too. They understand activism for sure. I think it indicated about 91% were between the ages of 18 and 29. And that's huge. That's a message to us. Thank you.
I'd like to add one more thing. I'm in my late 50s, so I am like the oldest of the oldest person among the young people. And it's young people that are involved now. Um, and people like myself, we do have to find our space. Our space may not be at the microphone leading the charge. I think that one of the things that some of the older people have is wisdom, because young people, they can get hurt. You can do some things to put your life at risk. And a lot of the older people may know ways to maneuver through these times, but we still have to keep the energy hot. I just wanted to add that.
Thank you. Thank you so much for that. We move to the next question. How do you feel public institutions such as education, public health, criminal justice system need to address the current issues of racism in the United States, as COVID-19 and the racial unrest that we've just experienced reveal social, political, and economic systematic disparities toward African Americans and other communities of color? I can repeat that if you need me to.
I think I understood it. I like to say that more pressure needs to be placed on the public institutions. I don't believe that any of these institutions have ever been through anything like this before, with a whole nation shutting down. And at the same time, everyone sheltering in place, everyone watching the news, watching on their tablet or their phone, and they're able to process things like they've never processed things before. It's going to have to be more pressure on these institutions to listen to the hearts and minds of the people, to listen to the things that have failed before. They will not work. And there's more than enough of us that have researched over and over again that it's not going to work. And we've also researched some best practice ideas that's working in other communities. So it's going to be a huge wake up call for a lot of these institutions that may have benefited or benefited from just being believed, just us taking things from them on face value. Well, that day is over. You know, a lot of people are researching and they're asking follow-up questions. So I would think that the public institutions have got to be more open-minded about what's next. And whatever we've done before, it's not going to work. It's going to have to be new. So that's how, you know, I feel that public institutions are going to have to deal with this new awakening because it's not going away.
And I just want to second that just by saying I believe every institution, whether it's public, private, et cetera, I think everyone has a role. And what I like about the momentum of what's going on right now is that people are looking inward. Organizations are looking inward and trying to figure out what they can do to combat racism, to combat racial injustice. But just speaking specifically about educational institutions and public education, I think the first thing that I'm recognizing is that we have to tell accurate American history. And what Juneteenth was just a couple of weeks ago. And I was shocked by how many people, educators, people who teach at private schools, public schools, and just everyday citizens came up to me and said, I'm embarrassed because I had no idea about Juneteenth. Now that's something that in the African American community, many of us grew up knowing about, but that's just something like Juneteenth should be heavily incorporated into our lesson plans, especially when we talk about history. I mean, that is our American history and it should be taught. You can go onto the criminal justice system and, obviously, as I've mentioned, that's been my background within the law. There are so many things that we can do. First of all, I truly believe that it takes collaboration between not just law enforcement, but neighborhoods as well. When I was in New York City as a prosecutor, I was excited when I saw the NYPD working with neighborhoods because there were several officers who took a keen interest in this and wanted to make sure that people in the neighborhood knew who they were, and not just because they were patrolling in their cars, but they were getting out of their cars and they were walking around and making sure that they actually met people and talked to the woman that was on the stoop and talked to another person who might have been hanging out outside of a corner store or a bodega to make sure that they were in touch with what's going on in the community. There's a word that's often out there in this space called credible messengers. And, we often talk about it in the realm of reentry, the idea that when people are coming home from being incarcerated, and oftentimes the people that can get to those men and women the most are people who have been through the same experience. So I think that when we talk about the criminal justice system, going back to this idea that, credible messengers are important and finding a way to figure out who is going to be listened to. It may not be me. I'm humble enough to realize that walking into the community with a suit, I may not necessarily be the first person that's listened to, but another person who has been there, walked the walk, and knows people's names in a sense that that's the community they grew up in, that's a credible messenger. And those are the kinds of people that we need to embrace when it comes to conversations. Also, neighborhood groups. I'm a big fan of the idea of cadet programs where you talk to young people and try to encourage them to think about, our Constitution and law enforcement and their role. And also, I'll say that educators, I think you all have a very big responsibility to push your students into fields where they can make a difference, such as the law, such as law enforcement, the medical field. Federal public service. There are so many ways in which a guidance counselor or even a teacher just taking an interest in a young person can just change the trajectory of their life. And I think that especially in this time, this is the time to reach out to that student and tell them, to breathe life into them and to let them know you can have a role in this conversation and you can help others by serving. So I'm just thinking as I think about those different institutions that definitely the education system, it starts there so that as parents, they're not then learning about these things. And also the criminal justice system is ripe with opportunities to make sure that we connect with the community and with people who are just, whether they're a leader, a pastor, or if they're just someone who just actually cares because they've lived in the community all their life. I believe that our community is ripe for change if those different institutions are involved.
Fabulous. Thank you.
Right. If I could add, I never thought that I would follow up Ashley with everything that Ashley is saying. Why am I even here? Uh, you know, it's so important to be on the ground. And when she talked about those public institutions being a part of the community, there's nothing better than that. That instills trust in the community. I was a part of a class with the University of Toledo. I can't remember, maybe I think it was with Dr. Hamer, and we did social learning. And we took the class into the community, and they met some of the young people that worship there, that go to school there, that have businesses there. And if you were to apply that to criminal justice, getting the police back into the community, education, that right there builds trust in the community. And that's one of the things that a lot of us feel that we're insulated from, that type of relationship. So I just wanted to just echo what Ashley said regarding one of the changes that needs to happen, that we come out of our ivory towers and just go right to the people. You know, they're there, they're waiting for us, they're waiting to embrace us. They're not afraid of us. Uh, there's no need for us to be afraid of them. And they need our support, and we need theirs. So thank you, Ashley. That's an excellent point.
Amazing. Thank you. Thank you. Okay, we're going to move on to the next question. We do have a few more questions to go. But I do want to, again, I want to thank my panelists. You guys have been awesome in your responses, and have really opened up some good dialogue to take back, you know, to talk about some more, because some of this I've not thought of myself. So thank you. Next question is, during the civil rights era, in the 1960s, we saw huge political and legislative changes that created a civil rights bill for African Americans and other disenfranchised groups, toward a transformation, or towards a transformative move for social justice. And these changes resulted from a massive national and political push from leadership groups such as Dr. Martin Luther King and his followers, as well as many others. The question is, how important is a type of leadership similar to Dr. Martin Luther King's to keep the focus on an agenda? And the second one is, what should be the agenda? And does the level of leadership even exist today?
Hi, so Darren Gordon. So as far as what the agenda, what should be on the agenda, whenever I'm thinking of even our current civil rights, our goals, it should always be restorative justice and equitable distribution of resources and opportunities. If that's not what's on the agenda, if that's not what the agenda is made about, then there's no agenda. That's the main thing that a lot of people of color, specifically Black people, are fighting for. We're trying to figure out what, or not trying to figure out, we're trying to pressure our governments to give us what we are owed, or to recognize that the centuries of slavery actually had an impact. We all know history plays a role as we get down to our more modern times, but for some reason people don't understand that ideology, and maybe because history is taught in an interesting way in certain places. But I think those two are the biggest things that should be addressed on any agenda. And when I think about leadership and the type of leaderships that exist, I'm like extremely proud that there's such a diversity in the different types of leaders, and that there's not really just this polarizing idea of what one leader should be versus another, like there was in the 50s, 60s. I like that there's a lot of different groups who are all keeping a relatively similar idea of what bigger issues we want to address. And it's not just like a single figurehead. I think when we have a single figurehead, it puts a lot of pressure on that person. And when we have a group that's there to just really represent us as a whole, it allows us to take a lot more responsibility for the change that we want to see.
Thank you, Gordon. Thank you for sharing that. With anyone else?
Yes, so I definitely agree with Dr. Gordon and with you, Dr. Bland. There should be an agenda, but I also recognize that that agenda is going to be different in every city and in every community. I think that working with community elected officials, community organizations, and also engaging the business community as well, and educators, I believe that we can form a coalition to determine what the needs are. And Dr. Blaine, I think you said that at the very beginning about identifying what a community's needs are. But I think that's part of it. Once we identify those needs, then we can create that agenda, which is what I was referring to in the first question that when I was talking about a policy agenda. And also in terms of whether or not we, I don't think we have to reinvent the wheel. There are organizations, but we can't be afraid to look outside of, for example, Ohio. I'm very fortunate and blessed to have lived in Washington, D.C. and in New York City. And therefore, I had the chance to talk to people who were members and who worked for the NAACP Legal Defense Fund, for example, and other organizations like the Urban League. And I think that, by talking, the NAACP, obviously, which is still active here in Toledo. And I think by working with organizations, especially at the national level, and looking at their policy agendas, I think that can give us some ideas for what we can bring to our community, but also looking at similarly situated cities and saying, okay, what are some of their challenges? Do we also see those same challenges here? And what are they doing? I think that history repeats itself. So, I just don't think that we can get tired or complacent. I think we have to, keep the fight going. What I love is just, the words of my colleague here on the panel. His name is Dr. Muhammad, Mr. Muhammad, or Brother Muhammad, excuse me. I love the fact that he talks about engaging with those who came before us. I'm very fortunate because I have a long line of people who came before me, who I talk to on a regular basis, who they give me an idea of what was done before, what worked, what didn't, what needs to be tweaked. And I think by working together, we can really figure out how to create that agenda. But what I'm talking about, or what I'm very passionate about, is going beyond the statement or going beyond just writing something down. And I want to go from that step of identifying the needs to implementing policy that can actually make that goal a reality or make that need a reality. So I truly think that, if we go back to a village mentality, when I was growing up, my mom would always say, it takes a village to raise a child. And she knew that was true. And that was true in my life, from aunts and uncles to people in the community who had a hand in making sure that I was okay and I was educated. I think if we go back to that village mentality and we say, you know what, we are not going to be okay until my brother next to me or my sister next to me is okay. I think going back to that mindset of that village mentality and using that to figure out what our needs are, and then again, taking that from an idea to policy to implementation, I think that's really going to get us on track and to make sure that we go in a positive direction to change our country.
Right. And I agree with Ashley. In 2015, the Nation of Islam had the 20-year anniversary of the Million Man March, and we called it Justice or Else. And we lifted the words of Dr. King. Were it not for Dr. King, we wouldn't know that a civil rights bill could be written. However, we didn't write the bill. Someone else wrote the bill, wrote those policies for us. Were it not for Dr. King, we wouldn't know that that could be done. What's happening now is we're creating our own policies. We're growing our own politicians. We're funding our own politicians exclusively without outside help. so that when we get them into office, they can actually institute our policies into law. That's something that hasn't been done before, but those are some of the things that the young people are talking about now. I think that what should be on the agenda is human rights and economic justice. Civil rights gave us the opportunity to spend money with those who were oppressing us, were to and patronize their establishments when in reality we had our own. So the agenda for today should be human rights. There's so much that was missed from that civil rights aspect of it. Dr. King didn't write the law. He didn't write the policy. However, we wouldn't be talking about this without him. There were two Dr. Kings also. There was the 1963 King that all of us love, all right? There's the 1968 King that was more Malcolm than Malcolm, you know, and we know little about him. We embrace both the kings and the ones in between. And yes, we do need leadership today because leadership creates unity. And even in the 60s, we didn't have just one leader. There was SNCC, there was CORE, there was the NAACP, there was the Urban League, there was the Nation of Islam, there was the SCLC. So there was never one leader. And we still have that today. If you listen to TD Jakes like I do, because there is a spiritual component to what we do. If you listen to Dr. Claude Anderson and how he breaks down economics, if you listen to Minister Farrakhan, so we have the full package, you know, today. It does exist today, and we can benefit from all of that leadership to get us where we want to go. And also I attend the NAACP meetings here in Toledo. They're active. The NAACP has been behind all of our social justice drives in Toledo. So I wanted to say that because the NAACP, they're not the ones that would get on the microphone and talk about who all they helped and how they've helped them. And Ray Wood, Anita Madison, and the staff there has done everything for CSRN and Black Lives Matter to do all of the things that we can do. So there is unity, but you don't work in unity, you wouldn't know these people work together, you know. So I wanted to add that.
And if I can just follow up for a moment, that is exactly right, unity. And we don't all have the same thoughts. Everyone that's within our community understands that we are all individuals who have different opinions on different issues. But it's a tool of those who want to divide us to basically elevate those differences and almost make it seem like we're fighting against each other. But we know the truth. We know the truth. And we know that's a tool of those who would like to divide us. So I totally agree that coming together, recognizing that we're smart, we'll figure out the nuances.
Yes.
But big picture, we can all get on the same page. So I think that's important in these times, especially to not let anyone divide us. But I think that goes back to that village mentality. I can't be comfortable with my seat at the table unless someone else has a seat at the table. And I think if we have that mindset, I don't think that we'll let anyone divide us, and we'll have that unity that you're referring to.
You guys are amazing. You are on fire. You are on fire with your messages. Thank you. Thank you. I'm going to move on now to the next question. The COVID-19 pandemic is a health and mental health crisis, which has also been correlated with social injustices through the evidence of uncovered inequities of vulnerable and marginalized populations. What would you presume would be the solution to the problem of racial disparities related to COVID-19? And I'm sure, I think some of you have touched on some of this, but not very
Mhm.
specific to this pandemic, which we now see a huge spike right now that we're dealing with.
Well, I know Dr. Gordon probably has many different ideas on this particular subject, so I'll talk first so that he could, I know he's gonna have a ton of great ideas. But, you know, when I think about the racial disparities attached to COVID-19 and how it has disproportionately affected African Americans, especially, I think, and what I've read is that, I mean, this is a result of inequities before COVID-19. I think we have to recognize that because there were already economic inequities, and I think that Dr. Gordon talked about that. And when you talk about limited access to health and wealth, that's what's happening here. I mean, just the luxury of being able to go to a doctor, having insurance, being able to pay a copay, to figure out if you have a pre-existing condition. I mean, that is a luxury, but it shouldn't just be a luxury. I think that, but that is exactly why we have been disproportionately affected, because not everyone has that ability and has that chance to get those services and to figure out that information. We have such a high rate of these pre-existing conditions, from diabetes to heart disease to asthma. We knew that before COVID. But we're realizing now what happens when everyone doesn't have that equal chance to go to their doctor and figure out what's going on. Also, there's stigmas related to the healthcare industry that many of us know about, especially as African Americans and African American women. We want to be listened to. We want to make sure that when we go to a doctor and we tell that doctor what's going on, that they believe us so that we can get the care that we need. Honestly, the other thing in terms of disparities is that we are often the first responders. We are the nurses. We are the people that are there. We are putting ourselves at risk in order to feed families and in order to make sure that our families can continue to survive. So I think that that's also something we have to understand, is that even if you don't have a pre-existing condition, you may still feel the pressure to actually go into work. But then, okay, let's talk about going into work. Well, in some cities, the only way that you can get there in terms of commuting is public transportation. So we're talking about buses, we're talking subways, we're talking all of these different things. And you're potentially exposing yourself just to get to work as a first responder in order to help people. So I definitely think that it's not a surprise to me that, African Americans, especially, that we are disproportionately affected by COVID. But again, just going back to what I said at the beginning, this is a result of pre-existing situations and just the inequities that existed before COVID that are starting to really show its face. And that is exactly why many of us are disproportionately affected and are experiencing these symptoms, and sadly are being affected at higher rates than other groups.
Awesome.
Before Dr. Gordon, I wanted to just add something. This is our Katrina, COVID-19. It's our Katrina. I wasn't nowhere near New Orleans, when it flooded, but it showed the disparity in service to people of color. The COVID-19, it showed me who could stockpile toilet paper and who couldn't. I wasn't one of those that could stockpile it. That was frightening. What are we going to do? I should have left out the last week, but I just don't shop like that. Who could stockpile Lysol at $5 a can? That used to be a luxury. If we had a can of Lysol, somebody was buying it by the case. I wasn't able to do that. And there are so many other things that COVID-19 revealed that, we didn't have access to. And it's still revealing, those things, as we speak. And I think that a more cultural centered education for us in what's happening, and then over here with our diet, it's not as if COVID-19 wasn't bad enough, but because of our cultural diet and our lifestyle and where we're made to live, it just compounded the effects, of this virus. So I think they're talking about COVID-19 as just a wear masks and gloves. There's more that needs to be added to this for the way I think for us as a people to really understand it. So that's what I wanted to add to it. And Dr. Gordon, hey, I'm taking notes now. At this point, I'm taking notes.
So I actually first want to just go back to my idea of what I said before. I think a lot of ways we can address these problems, not with just COVID-19, but any racial related problem, is the establishment of true restorative justice, and establishing not just promoting, establishing equity in any system and any program and any facet of anything we're trying to use to actually fix these communities. We're done with the promoting. It's now has to be very strict and in strategic ways we want to address these issues. So that's my overarching thing, is when we actually do true restorative justice, when we figure out that, oh, because what happened 400 years ago is having an impact now, then we start to rewire our minds into figuring out solutions for those problems. Now, as far as, a lot of people may or may not know, but there, like it's been already talked about by my wonderful two panelists, that there are these other issues that come into play with why these disparities exist. One of those things that I always like to talk about, because people don't really know about it, is the idea that Black people specifically, are stressed a lot. And that stress just manifests itself. And I really hope that as they make this a public health initiative, that they do more research. But if they really do more research into how this stress is having more of a physiological response in us, and resulting in things that we have, like higher cardiovascular rates, high female mortality rates from having children, diabetes, and all these other ways, we can really put more of a specific term to why these things are really impacting us. And when people think of stress, I have lived a pretty decent life, but I'm stressed a lot still. And I'm stressed thinking about things being a Black man. And it was interesting, I read a study, and this is why the stress thing was just so amazing to me, was that maybe 10 or 15 years ago, the study came out, and they looked at African women who came to America, and they saw that their levels of stress, the cortisol, which is the hormone that's released in their body as a result of stress, was higher when they came to America. Still live the same life, but when you compare their stress levels to those their family members back in other parts of Africa, it really showed that America is really stressing people out, and it's really having a large impact on a large impact on our lifestyle. So again, when we start to actually address the issue of racism, and when we start to call it what it is, when we start to put it at the forefront of all the issues, and really start to address, and it's amazing. I'm so happy of with all the things that have happened in the last few months, as far as people trying to step up to change it. But what people also have to realize is that, changing a few things here and there, and adding a few letters and taking some faces down isn't really what's changing it. We need to really get to the root of the issues. There needs to be access, easier access. There needs to be, I don't necessarily want to say reparations, but people need to be, we need that restorative justice to get us back to a place that put us on an actual playing field, an equal playing field. And we don't have that ability to live in equity if we're not having a system that's saying we recognize the issue that we put you guys in.
Amazing. Thank you. Thank you so much. And that's a really, we thought that's a really important topic for now, because of particularly as we're talking about the health disparities with COVID right now, COVID-19, and the fact that we are now looking at a resurgence of this pandemic. And many are saying that we're still in the first phase of it. I mean, we have not Just, you know, we haven't gotten to that second wave of it yet. So and not only that, we're still looking at such high disparities in terms of the racial breakdown. That is not going away, and we must continue to have these conversations about COVID-19 and how it is impacting communities of color. So thank you. The next question that I have may be our last question. What has motivated you to focus on advocacy in the field of social justice? And what advice would you have for others who want to make an impact in our communities in this area?
Well,
I'll begin to say that. I consider myself an advocate. I was that kid in school who talked all the time and would always get in trouble. And I was always trying to figure out what my passion and what my life's work would be. I think it was Oprah Winfrey who said, your life's work is to figure out your life's work. And I believe that that's true. So for me, when I grew up here in Toledo, I'm a Toledo kid, and I was very involved in the community, but I wanted to make a difference. And I found that space when I went to Washington, D.C. for college, and I had the chance to work on Capitol Hill and actually work with members of Congress and senators and actually figure out how this thing works, you know, how to go from a statement or an idea to actual implementation of a policy. So for me, this is my life's work. I am an attorney also, so obviously my form of advocacy now is in the courtroom more often than not. But I just want to emphasize my background to say that, especially growing up here in Toledo, there are so many bright people that are here. We have some serious thinkers that are all over the country, but are definitely still here. And many of them are in classrooms, especially in Toledo Public Schools. And I think that when you see that kid who just seems a little hyper, talks a little bit, you know, just kind of can't seem to quiet the person down, cultivate that. Figure out what you can do to get that kid active and involved so that they can be a future advocate. Because that's who I was, but I just didn't know the word back then. I just knew that when I had thoughts and ideas, I wanted to push them forward. But back on the subject of social justice, that's what it's all about. We are here living in this country, and I would just challenge every single person who's listening and every person that you come across, tell them, ask questions. Don't just take things as they are as you walk around through life. Be an active learner and an active participant in life, and ask those questions. Ask, why do things exist the way they do? Take your particular area. Maybe it's COVID-19 and health disparities. Maybe it's injustice with law enforcement. Maybe it's, you know, something completely different. But figure out, going back to what I said earlier, figure out your lane and figure out, you know, what needs to be improved in my community. As I said before, if you're an artist, maybe your art is the way that you can advocate. You know, are you a business owner? Maybe through your business, that's how you can be an advocate. But again, I think it's just figuring out your lane, figuring out what needs to be improved, what are the needs, as Dr. Hope Bland mentioned earlier, and figuring out, okay, advocacy, let me get the tools necessary, let me do the background research, let me figure out what the problems are, how to fix them, and then take the steps necessary to figure out who can help you get that need or that goal accomplished. So all of those things are what's motivated me to focus on advocacy. It's a passion for service. It's a passion for wanting my community to be better than it is. And, you know, gathering all the information I've gathered from my different careers and in different cities I've lived in, and saying, I want Toledo to be that and more. So every day, that's my mission, and I'm just willing to work with anyone who also shares a similar vision.
Yeah, and I'll add to that. What's motivated me is realizing that we don't all have to believe the same thing. I came to that realization. I had joined a multi-faith group maybe in the early 90s. We would meet at the on Bancroft in Collingwood. I think it's Miss McKinstry's church now. And there were people from all different faiths, and we were focused on one agenda, improving the life of those in that Collingwood, Bancroft area. And it was at that time that I realized that, no one's going on to hell on a technicality. No one's going, I cannot be the beginning and the end. Everybody at my church, we just can't be the only people on the planet that's going to heaven. That would be insane to believe that. If you don't believe how I believe here in Toledo on this corner, then you're doomed. And if you are doomed, then how do I treat a people that I'm already condemned? And it just didn't add up to me. And that freed me from believing that the only people that I can organize with have to be Black and they have to be Muslim. It just can't happen. And that was a motivating factor for me. And it is today that it doesn't matter who you are, it's your skill set and your love for humanity that separates you from those of us that have letters. And that continues to motivate me. I continue seeing people work together who we may have been told before that you'll never work with this guy, she'll never work with you. We don't talk to those people, and they're making stuff happen. That's been a motivating factor for me, and I think that that's the new way. And a lot of us in the faith community are going to have to realize this, that you just don't have to be your particular faith to get something done. Everybody's past you. All right, you're late if you think that the only people that are that can do this have to have a collar or a bow tie. It's just not happening, and that's why I love what Black Lives Matter has brought to social justice. It unlocked all of us that wanted to help, and now we can help because we love, not because I belong to one organization. And it's a very freeing experience, and I believe that's why we're able to achieve the successes that we're getting now. And I think that we'll move beyond criminal justice to eliminating food deserts. We'll move beyond food deserts in our own schools, and on, because we're just not locked into thinking that the only thing that impacts Black people is prison reform. If it doesn't, man, I feel bad for us. But there's more to Black people than just criminal justice reform. There's more. I mean, there's so much more to do, so much work to do, and I'm here for it. And I've actually saw it happen, and I'm waiting to see more.
Thank you so much, Brother Washington. And for the sake of time, because we're reaching that hour, Dr. Gordon, did you have just a brief message, a brief statement to say?
Yeah. So I'm motivated by the lack of medicine, by the lack of Black people in medicine, and I would encourage, if anybody knows anyone who's interested in going into medicine or law or any other type of community advocacy, that, like Ashley has said earlier, please help cultivate that, and please help bring them to the forefront of the roles that they can play in changing our world.
Right is, again, thank this panelist. You were phenomenal. You guys were on fire. You got to the point, and you raised a great deal of awareness. And I want to just again thank each and every one of you. I would like to turn this over now to Dr. Jeffries. Not sure if I don't know about the answering questions, but I'm going to try.
Well, again, as Dr. Bland said, thank you so much for participating this evening. We only had one question, and I think that it was answered, and it was to Dr. Gordon from R. Allen. What would you suggest your peers, colleagues do to contribute to assuring disparities are eliminated in the health field? So I know that you did answer that. For the sake of time, I just wanted to share the question because it is 6 p.m., so we do have to end. So I thank all of our participants for coming on this evening, and again, for our panelists. Thank you.
Thank you.